Good morning. My name is Cheryl Holt. I work with Navigant supporting the TennCare PCMH and HealthLink initiative. Welcome to our July PCMH webinar on keeping the care team engaged, involvement, taking ownership, and training. I want to remind you that this is an interactive webinar. While you can ask questions audibly, you can add your questions in the chat box at any time during the webinar, and our presenters will address them during the Q&A. Click on the chat box icon and then select Everyone so that your question can be viewed by all attendees. Today, our presenter is Wanda Rogers. Wanda has more than 20 years' experience in healthcare. In her current role with Navigant, she provides technical assistance and coaching to clinical practices in developing patient-centered transformation strategies required for NCQA recognition. Her key areas of specialty are healthcare compliance, program development, and revenue management. Thanks, Wanda. And also thank you to Ripple Patel for her assistance in developing this presentation. Ripple currently works as practice administrator for Darsalog Care. This webinar is being recorded, and the recording and the slides will be posted to the tenncare.gov PCMH website at a later date. Thanks again to everyone for joining. I'm going to hand it off to Wanda.
Thank you, Cheryl. Good morning, everyone. As Cheryl stated, my name is Wanda Rogers, and I am one of the PCMH and HealthLink coaches with Navigant, and I'll be the facilitator for the webinar this morning. I'd like to thank you for giving your time and participation in this webinar. And our goal is to provide you with a detailed overview of team-based care, identify strategies for team engagement, and the importance of ongoing staff training to promote ownership and maximizing skill sets within your team. Our learning objectives for this webinar will be to identify strategies for engaging the PCMH care team, identify strategies for promoting a sense of ownership among the care team, and identify key elements for training the care team. The team-based care webinar is taken from the PCMH concept, team-based care and practice organization. We'll have several of the cores in team-based care that we'll be referencing throughout the webinar, and we'll have those examples and references at the end of the slides for you to review. Okay, in this slide, the picture is used to depict what is needed to have a good relationship among patients, providers, and the care team. A practice that provides patient-centered team-based care takes a patient-centered approach to planning and developing and delivering care. The practice is viewed as one who develops good relationship with patients, actively seek and appropriately respond to the patient's preference and values, and needed to support patients in achieving their health care goals. In this figure, individual patients are seeking care at a primary care practice. It appears they encounter a united provider team where there are good relationships among its members. And the patients should see the team as a well-functioning unit, working together collaboratively and talking about patient goals and outcomes and involving the patients in the process. All of these components serve as the blueprint for utilizing a patient-centered approach for delivering team-based care. This is an overview of team-based care, which is defined by the National Academy of Medicine. And it reads as the provisions of health services to individuals, families, and or their communities by at least two health providers who work collaboratively with patients and their caregivers to the extent preferred by each patient to accomplish shared goals within and across settings to achieve coordinated, high-quality care. slide 8, we're talking about the advantages of having team-based care. Multidisciplinary teams convey many benefits to both the patient and the health professionals working on the team. Teamwork is an optimal method of delivering exemplary health care for practices. Teamwork is an optimal method. It offers efficient and effective teamwork, providing benefits not just for the team, for the patient, peers, and families and support systems of the patient. Your workplace becomes more enjoyable and productive when you can operate as a team. Safety issues are reduced while retention rates are also increased. And at the same time, patient care improves with seamless collaboration and enhanced communication. When practices draw on the expertise of a variety of provider team members, patients are more likely to get the care that they need. And some of the advantages of having team-based care embedded in your practices, that it improves health outcomes and enhanced satisfaction for patients. And the more efficient use of resources and enhanced job satisfaction for team members. It also provides the opportunity to engage team members in a data-driven continuous quality improvement. Therefore, you're improving the quality outcomes of patients and the level of care that's required for each patient. Okay. Some of the elements of a successful care team environment. To help a successful care team, we must remember to inspect the reflection of our environment. This slide is highlighting some of the PCMH cores, specifically PCO2, which talks about the key roles and responsibilities for your PCMH lead and how your organization is structured to make sure that you have a team-based environment. The importance of outlining and defining the roles and responsibilities also helps to minimize confusion, conflict, and power struggles that may sometimes occur within a team setting, especially in the early phases of team building. It aims to create an environment that is open and non-judgmental. It encourages people to voice their opinions without having their discussions censored. You're able to keep your team informed about what's happening in the wider organization and how it affects them. The more open and transparent you are, the easier it will be to build trust and create good relationships. And lastly, it's important to evaluate the team's composition for effectiveness in certain areas related to the dynamics, problem solving as a group, productivity, and growth. And just to mention a few of the examples that we have as elements for a successful care team: a culture of trust, strong leadership, clearly defined roles and responsibilities, which is also a reference to TCO2 in the PCMH NCQA standards, respectful and empathetic open communication, appreciation of diversity, establish common goals, solution-focused problem solving, and ongoing evaluation. Involving care teams. This slide also coincides with team-based care cores 1 and 2, such as developing organizational charts and identifying the key roles for key staff for PCMH and team-based care. It's important to make sure that each staff feels valued and respected as an employee and also as a team member. Involving your care team includes the development of the mission statement as an equal participant of the team, allowing your staff to have input in developing the mission, defining the goals, and developing a shared aim that's specific, measurable outcomes and objectives. You also want to ensure quality and outcomes of care that are included in your process for your care teams. Having opportunity to rotate your team members and include each team members in your QI efforts. And you want to make sure that each team member is trained, that you have opportunities within your organization where you foster education and growth, which will help your employees to feel competent and identify confidence when they're working with patients and providing care. And it also helps to make sure they're competent in performing not only their roles, but also the roles of other team members. Boosting team engagement. Keeping your team motivated and engaged is a challenge that is a common task among many practices. And unfortunately, there's no single strategy or way that is applicable across the board because every person in practice is unique. It takes time and creativity to build and boost team morale and engagement. And just remember that it's important to recognize that every staff member, every team member has something valuable to contribute. So making sure that you're investing in growth and opportunities for advancement will help to keep your team engaged and boost morale. You want to make sure that you're prioritizing opportunities for learning and development in whatever the different ways that you would like to provide your staff development, your training, identifying resources that you can provide productive and effective training for your staff. You want to deliver feedback and opportunities for learning early on and often. And you want to make sure that you align team goals with organizational goals. All of these components create a welcoming community for new staff and your existing staff. And I believe that starting the engagement activities early and use of succession planning help to create a clear and smooth career path for employees. I recommend that you have new hires hit the ground running by networking early on with coworkers to drive home the organization's high expectations and ongoing engagement. Succession planning and strong employee retention has been linked to the long-term success and overall job satisfaction. And you can find this reference in the PowerPoint presentation. And I think there's a link for New Jersey healthcare system, identifying some of the opportunities and some of the initiatives that they use to boost the morale and keep their team engaged overall. Okay. The next slide is talking about taking ownership and building coherence among the team. Building coherence in relationships among team members is critical to providing patient-centered team-based care. If team members cannot communicate well with one another or see themselves as individual, independent providers, care may seem fragmented and disjointed to the patient. That's why it's important to promote an environment with structure, having a leader who is a good listener and a communicator and able to problem solve effectively. Leaders do not have to be a clinical person. This can be one who has experience in dealing with power struggles, one who has experience with developing teams and initiating team-building activities to keep your team engaged and keep morale high, one who has experience in how to handle conflict within group members, and how to make good decisions, and how to involve each person in the decision-making process. Promoting team to patients. Making patients aware of a team-based approach increases each team member's sense of belonging and value to the team. You want to make sure that you introduce your patients to all of the team members and that they know the roles and expectations. Create visual cues and reiterate teamness to patients. Demonstrate respect among team members and demonstrate patient information sharing among the team. Okay. And this slide is talking about the development of team workflow. Workflow mapping is a way of making the invisible visible to each practice. It provides a true representation of how work is being done and offers opportunities for improvement is monitored and updated on a regular basis. Workflows can be developed for many key functions such as care coordination and care management, and it can serve as a visual check and balances for the practices. And some of the benefits of implementing and developing workflows would be accountability, having improved processes, increased efficiency. It reduces waste and error and improves patient outcomes. Okay, slide 15 is talking about the importance of communication. Effective communication is essential in any practice. It's ensuring that the care is continuous and patient-centered, as well as coordinated and coherent. It's the pathway in which teams communicate and members become aware of each patient's needs, their cultures, values, preferences, and understand one another's role in delivering care to the patient. There are various ways in which practices and organizations can make sure that they have good communication and good communication strategies. Some of the examples that we chose to highlight in this slide is written and verbal information sharing. For written information sharing, some of the components would be shared medical record systems, shared care plan, using real-time communication methods. For verbal information sharing, co-locating staff, team members working at the same time or having overlapping schedules, using daily huddles, and schedule times to review processes, fine-tune roles, and etc. One of the key things that you want to remember is in whatever method that you decide to use that's best for your practice, you want to make sure that the communication is actually taking place. You want to make sure that you have someone designated to oversee this function, and you want to make sure you have methods in place to monitor the quality of the communication to make sure that it's continuous, it's open, and it's effective. Okay? The next slide is talking about the handoff, which is the transfer of information along with authority and responsibility during transitions in a patient's care. And it includes an opportunity to ask questions, clarify, and confirm. And it also transfers authority and responsibility. And some of the components that go into a proper handoff will include responsibility. And that's the person being aware and assuming responsibility. Accountability. You're accountable until both parties are aware of the transfer. Uncertainty. You want to make sure that you're clear of all ambiguity before the transfer is complete. And communicating verbally for clarification and follow-up, acknowledgement, ensuring that the handoff is understood and accepted on both parties, and opportunity. You want to make sure that you evaluate the situation for both safety and quality on an ongoing basis. Okay. Slide 17, this is just speaking of check back, which is a closed-loop communication strategy that verifies and validates the exchange of information with members of the team. And in this slide, this particular diagram, basically is showing the flow of communication and what the process should look like. It involves the sender, who is initiating a message, the receiver accepting the message and confirming what was communicated, and the sender verifying that the message was received. And this is a good check and balancing system to implement to make sure that the communication has been effective and that it's been shared and received and reviewed by both parties. Okay. Slide 18 is just talking about policies and procedures used to support your care team. And we all know that together policies and procedures provide a roadmap for day-to-day operations in our practice. They ensure compliance with different regulatory standards, healthcare laws. They give guidance for decision making and also help to streamline your internal processes. And some examples for procedures for some of the PCMH or HealthLink practices, we have prescription refills, informing patients of laboratory results, making patients appointments. Just a few examples that we chose for this slide. Okay, and also policies are helpful in developing work schedules that allow time for team members to perform all parts of their job. It's adequate levels of permissions and EMR to allow teams to perform their jobs effectively. One of the key takeaways for this slide is just making sure that you have designated staff who are monitoring standards and guidelines and regulations to update your policies and procedures as changes are made to guidelines and regulations, and making sure that that person is communicating to the team about changes in policies and procedures, where to find that manual, how to use that manual in day-to-day operations. So it's important to always have someone to provide access to your manual, do training on your manual, highlight changes to make sure that the staff is using it accordingly and to drive their decision making and to make sure they're in compliance with all of the standards and regulations. Okay. Tips for developing training for your care team. One important thing to keep in mind when you're training your staff is think about how the material and the resources can be beneficial to not only existing staff that you have, but new employees and recently newly hired staff. Ongoing training and education helps to increase confidence and competency when working with patients, family members, and also when you're partnering and collaborating with other providers out that's involved in that patient's care. It's important to consider how the training will be carried out and the types of resources needed for training purposes. And lastly, I would like to I think it's important to place emphasis on the details, the content, and the opportunities for developing and building new skill sets that will aid your staff in long-term growth. And you want to make sure that when you're training and developing materials for your staff, that it matches the team roles to the scope of their practice, their licensure, train the different type of licensure levels, the trainings and capabilities that foster team care and good cohesion among your team. And it offers opportunity in many ways for your key staff to train other staff members. Okay. Other things to keep in mind when you're developing training for your care team, it's just the different type of resources that you may implement on the way your training is done. There's training resource manuals. There's organizational charts that outline the roles and responsibilities. You can have job descriptions, and sometimes you'll have to revise those job descriptions based on the roles that your staff will have. There are often changes in the standards for PCMH to team-based care. So you want to make sure you look at the guidelines and the standards on what a PCMH lead, a provider champion, care coordinator, and you want to make sure that you include that information in your job description and update it as often as needed. Cross-training is another strategy or way that you can develop training for your team. And making use of your individual supervision sessions, I think that's the ideal time to really have the face-to-face with new employees or some of your staff that's been in positions for long periods of time to really develop and nurture the skill set, talk about maybe some things that they're wanting to focus on to grow, address issues, and have discussions centered around maybe some of the roles and responsibilities that they have. And also you could think about maybe having activities that train the trainers. When you have group settings, that's an opportunity to have everybody at the table together, communicating and really talking about training needs, educational needs, career opportunities, and growth. Sometimes when we're talking about training practices, automatically think that it has to be something outside of the organization, in which it could be expensive. You have to have certain expertise or experts to come in and train your staff, when in actuality, it's an opportunity for the practice to be creative and having key people to participate in ongoing training and bring that information back to the practice and serve as a leader in staff development and professional development to work with the organization as a resource. Okay. This slide is shared with us from Darsalou, and it's highlighting the approach that they use, the care team approach that they use on integrated care. And in this particular slide, they are focusing on the prevention of progression and underlying conditions. And some of the medical services that are offered by Darsalou: pediatric services, family and internal medicine, endocrinology, cardiology, cardiac and lab, ultrasound, wellness programs, laboratory and imaging services, optometry, and ER diversion units. And some of the support system services that they have in place will be referral coordinators, care coordination specialists, wellness and exercise coach, patient engagement centers, motivational coaching and mental health support, clinical research unit, and a multilingual support services. Okay. In this particular slide, Darsalud is referencing some of the roles and responsibilities of their care coordinators. And the activity that they're targeting is closing gaps for their diabetic population and focusing on their AC1s, echocardiograms, stress tests, eye exams, and wellness exams. The care coordinators at Darsalud are provided with a list of patients that have gaps in care by their primary care providers on a daily basis. And once these patients have been assessed and the gaps are identified, the care coordinators will staff each case with the care managers, nurses, and other members of the care team. And when they're staffing the case, some of the things that they want to discuss and determine is to make sure they have the appropriate level of care and support for each of their patients. They identify barriers, resources, and interventions that are required for developing an effective patient-centered care plan. And their care team meets weekly to discuss updates and progress and monitor the outcomes for their patients. They also have monthly meetings that include their medical assistants, their providers, some of their other collaborative partnerships in the community are done face-to-face or by phone conferences to make sure that any additional treatment and care has been received, communicated, and implemented into that patient's care plan. Okay. Structured communication for Darsalud Health. They chose to focus on their EHR. Pretty much every employee can be reached to communicate special instructions for patients using their EHR messaging. The overall team members have access to patient information through their secure portal of the EHR system. In-person structured communication happens on a day-to-day basis, and it involves the care coordinators, the medical assistants, and providers sharing details about patients that will be coming in for that day and talking about the services and needs of that patient, and also targeting patients that have missed appointments previously. For the telephone encounters, there's an internal communications message system that goes straight to the person who will be addressing the needs and the issues of the patient in regards to their care and any questions that they may have about upcoming appointments or visits or anything related to their recent appointments. And they encourage clinical needs for patients to be addressed within 24 hours. So there is ongoing and daily communication that is taking place within the team setting at Darsalud. Okay. On their monthly team meetings, most of the communication is structured using their EHR system to communicate with the providers, the medical assistant team, and also with a meeting that is considered a face-to-face in a group setting. Monthly meetings allow for employees to give feedback for clinical improvement. It provides clinical education for care coordinators to discuss the importance of closing gaps in care. It allows the opportunity to discuss feedback from other departments that directly interact and speak with the patients as well. So this is one of the areas where they really focus in on and monitor on a daily, weekly basis to make sure that communication is happening, that it's open, that it includes all team members that is involved in the patient's care. They also have internal checks and balances that they put in place to make sure that things are done timely and communication has been effective for that day and for each patient. Okay. And I think now we will be addressing questions, I'm sure, shortly. But I want to also remind you that we do have slides that are talking about the NCQA PCMH standards, where most of our information was taken from. And you can see that on slide 27, we have the team-based care core 1, which talks about the PCMH transformation lead. TCO2 talks about the organizational chart, the structure and staff responsibilities. TCO3, the external PCMH collaborations. TCO4, patient family caregiver involvement, and TCO5, which is the certified EHR health system, in case you would like to be able to find this information and see more details about team-based care and practice organization.
Thank you, Wanda. So we do have a question here for you. The first question: how often should the team meet?
NCQA does not have a requirement on how often your team should meet, but I would certainly recommend that that the PCMH lead and your provider champion are the ones that are really coming up with time frames of how often the team should meet, what information should be discussed when you're meeting, and what's best for the practices. Each practice is different. So if you have a small organization, you may choose to meet maybe twice a week for 30 minutes and just build from there. Whereas larger practices have the opportunity in different ways to meet via EHR, face-to-face huddles. They also can do maybe monthly or weekly staff meetings. So it really depends on the practice and kind of what, how their day is structured and how their organization is set to handle team meetings.
Thank you. We do have another question. Can you share some of the strategies practices use to monitor the effectiveness of team-based care?
Yes. A couple of my PCMH and my HealthLink practices used internal checklists. They developed just a day-to-day task sheet that should be done at certain times of the day from 8 to 12, based on the patients who were coming in, what was required for those patients, making sure that they had medical records, any labs, just whatever that was pertinent to that patient's visit. So they kind of built their own internal checklist, and they would review that at the end of each day to make sure that they really met all of their patient needs, that things were done on a timely basis and on time, And if anything was delayed, it was carried over for the next day. So it just kind of, I guess, turned into an Excel spreadsheet with accountability for staff, time frames, check-offs, and also one of the things that I think one of my HealthLink practices with their internal checklist, they use this as a QI training topic. So at the end of the week or at the end of the month, they looked at the checklist and to kind of see what areas that they needed to improve upon, and that became a focus for their QI for that quarter. Also using the PDSA to look at opportunities for improvement when you're talking about team-based care, and looking at your key staff, their roles and responsibilities, and making sure that they are being effective in those positions, that they understand the roles and what's required on a day-to-day basis. So just implementing those strategies and monitoring in those areas, I think, have been effective for some of the practices, PCMH and HealthLink.
Thanks. And we do have another question. Can you provide recommendations on ways to better manage employees' workload to prevent the risk for burnout and dissatisfaction?
Yeah. Again, in just speaking with, I guess, from experience with some of our practices in the last couple of years, one of the things that's been effective is just making sure when you're having staffing, that is to look at the caseload for each that each staff member have, and really helping them understand the levels of care. When patients are making progress, is it an opportunity to step that patient down to a lower level of care where there's not an intensity of services, making sure that the security level as well for the caseloads of your different staff. It helps to prevent the burnout. And just making sure that there's opportunities for self-care. You know, this is when you're doing your supervision, individual supervision. You know, that's an opportunity to talk about the workload, how it's affecting the care of the patients, the quality of life for your employees, opportunities to take some time off and just for self-care. So, and this can be done, like I said, within a team setting, individual supervision sessions, and really looking at opportunities to discharge, well, not necessarily discharge, but make sure patients are stepped down to lower levels of care when progress is made. And also, rewarding your staff, recognizing when they're working hard. Unfortunately, with the patients that we take care of, caseloads are high because of the nature of illnesses that we're working with. So, when you have an employee who has managed to provide effective care, and you see patients getting better, you see gaps in care closing, patients are coming in, they're more compliant with their appointments and their medications, that's an opportunity to say good job. And sometimes, if you're able to offer some types of incentives to your staff, it doesn't necessarily kind of take away from the stress, but it helps to feel appreciated, especially when you're working hard and, you really care about your patients. So I think it's important to not only look at caseloads, but also take time to recognize hard work and, show appreciation for your staff.
Thanks, Wanda. It looks like that we're out of time, so I'd like to thank everyone for joining us today. Enjoy the rest of your day.